Welcome to our 5 on 5. We're pleased to be joined by plastic surgeon Dr. Brian Kreul and Geri Gehr. Geri, you work at the imaging department at Asante Rogue Regional Medical Center, and you also are a survivor of breast cancer. Tell us about its role in your life.
Well, actually, I just mentioned to doctor when we were sitting out in the waiting area that sometimes I would like to not be the breast cancer patient, obviously. It's not something that you look forward to, but for me personally, this is my second time around with it, and the first time was 22 years ago, and I was much younger, obviously, and a single mother, so every day was a struggle in some ways then. But you know, working in the medical field, it also gave me an opportunity to be closer to other patients, other women. I saw a lot of patients every day who had just been diagnosed with breast cancer. So I felt at some points that it was not a blessing necessarily, but an incentive for me to live my life better, actually, and to help other women in any way I could.
Mm-hmm. And you chose to have reconstructive surgery, correct?
I did, yes.
How did you go about making that decision?
Well, actually, the first time was very difficult for me. The surgery had my original mastectomy had a terrible effect on my sons. They were young, and the thought of being operated on again was not something I look forward to. I had a very difficult time making the decision the first time, and surprisingly enough, you know, I was younger and I played a lot of sports, and but this time it was a very easy decision. And Dr. Kreul is my surgeon, and he was part of my surgery from the very beginning, and that was very important to me.
Mm-hmm. And Dr. Kreul, is everyone a candidate for this type of reconstructive surgery?
Not everyone is a candidate, but most women are candidates. A lot of their general health plays a part in that, so there are people that certainly aren't candidates to have any more operation than just to treat the cancer, but most women are a candidate in some way. We do reconstruction at various times. We can do it at the time of surgery when they first have their breast removed. We do it sometimes down the road, whether that's weeks, months, or years after their mastectomy. That all just depends on what their goals and desires are and what their overall health is.
Fascinating. All right, we're going to take a quick break. We'll have much more in just a moment. Stay with us. Welcome back to our 5 on 5. We're going to be here with Dr. Brian Kreul and cancer survivor Geri Gehr. Dr. Kreul, as a plastic surgeon, you know, we're talking about reconstructive plastic surgery. How do you counsel patients about whether it's the right fit for them?
Basically give them the options, and breast reconstruction is incredibly varied in that there are many different operations we do to reconstruct breast depending on a patient's situation. So a lot of it has to do with what they want to accomplish, and a lot of it has to do with what we have to offer. So each patient gets a long discussion about the various options, and they're allowed to choose essentially what they'd like to do.
Mm-hmm. And Geri, your two surgeries were very different, is that right?
Yes, they were. The first time I chose not to have reconstruction right away. So it was a little more difficult because the skin was tight, the scar was tight, and actually the whole surgery was just completely different. One of the things that I noticed most about both surgeries was that the lymph nodes were different. My first time, 18 lymph nodes were removed when I had my original mastectomies, and this time only 1 was removed, which makes a huge difference when it comes to lymphedema and things like swelling in the arms and things like that. This time, as I mentioned before, Dr. Kreul was in the OR when I had my mastectomy. He moved right in after the surgeon and started the process right away for me. So from the very beginning, he and I have been together on this process, and it was a little more difficult probably for him this time because my skin, we had a little bit of trouble with my skin and my breast because it had been altered with the other surgery. Oh. So, but you know, we've just taken our time with it, and it's been worth it.
Yeah, okay. All right, and Dr. Kreul, is this something people can afford? Does insurance cover any of this? How does it work?
Yeah, and that's important for people to know. Insurance does cover breast reconstruction. It's actually a federal law that insurance have to cover breast reconstruction much the way they would cover treatment of the cancer, and that I think is very important for people to know.
Okay, now is there any resources online or anything you'd point people to if they're watching at home thinking, I want to find out more?
Yeah, I think the American Society of Plastic Surgeons is a great resource. It's plasticsurgery.org is their website, and you can basically research anything relating to breast cancer and breast reconstruction through that website.
Fascinating. Thank you guys so much for coming.
Thank you.
Appreciate it. Stay with us. We'll be right back.